Hello viewers, I am Dr. Rahul Reddy from ANDROCARE Andrology Institute, Hyderabad. Today in this video I will be explaining about what are the causes for low sperm count in males. So, because this is a common question which is asked by all my patients who come to my clinic. So, I think this will help most of the patients to understand why their sperm count is low. So, first before coming to this video, I would like to tell you about basic male sperm production anatomy. See, now if you see this picture, this is the testis. Normally males have two testes and sperm production happens in the testis, and then once sperm production happens in the testis, it passes through this tube. This tube is called epididymis, and epididymis, this is the place where sperm matures. That means normally the sperms which are produced here in the testis won't have motility. Only when they pass through this tube, epididymis, then they get motility. So, now once they pass through this tube and enters this tube is called vas deferens, and from through the vas deferens they go and they are stored in the reservoir. There is one reservoir for the semen called seminal vesicle, one on both sides. So, now this is the place where sperm is stored. Normally this capacity of seminal vesicle is for 3 to 4 ejaculations. That means till you ejaculate 3-4 times, there will be enough semen there. That is why if you ejaculate 3-4 times in a day, after third ejaculation or second ejaculation you get only very few drops, because this reservoir is empty. And this is the prostate gland, this is the urinary bladder. Normally urine is stored here, urine comes through this tube. So, now whenever you want people ejaculate, the semen comes from this seminal vesicle and enters through the prostate and comes out through the urine tube. Now, to understand why semen count is on the lower side, see, there are so many wordings in semen analysis report. Oligospermia means low sperm count. If sperm count is less than 15 millions, we call it as oligospermia. So, there are 4 common reasons for oligospermia. So, one is a genetic cause. Genetic cause means because of some birth defect or some genetic mutation, your sperm testis is not producing sperms. Sometimes this is of 2 types. Sometimes they don't produce sperm at all. Sometimes they produce sperms in the initial days of your life, and generally after 25-30 years slowly the production will come down. Normal production should go till 55-60 years, but in some people, because of the genetic defect, it stops at 25 to 30 years. And this can't be treated. This genetic defect, generally what we can do is, people with genetic defect and low sperm count, we can only improve the quality of the sperm but not count. So, now second common cause is infections. Any infection in this tube, any urinary infection, sometimes anyway I will be making a separate video on infections, what kind of infections you get, how these infections are treated, how the bacteria enters the semen system. I will make a separate video. So, whenever there is an infection in the tract, it affects your sperm count and sperm motility, because if your infection is in the epididymis, then it affects only motility. Your sperm count will be normal, but motility will be on the lower side. Then infection in the seminal vesicle, the storage reservoir, then it affects your ejaculation. So, infections in the seminal vesicle is again important causative factor for premature ejaculation also. So, most of the patients with infections here, they will have premature ejaculation. So, now most of the people, they ask me, doctor, I don't have any pain, so how this infection has come? Because these infections are chronic infections. They are slow, they start very slowly, there won't be any pain, slowly they will settle down in the system. So, now these infections can be, if they are detected in early stages, we can actually cure them. And the third causative factor is hormonal imbalance. So, generally we have 4 hormones in the system. One is first three comes from the brain, FSH, LH, prolactin, and the testosterone is produced in the testes. In obese patients, we have to look for estrogen hormone also. When there is hormonal imbalance, or sometimes even vitamin deficiency, vitamin D deficiency, vitamin B12 deficiency, or testosterone deficiency, it can lead to oligospermia. Here, if we correct the hormones, then again sperm production will go up. The last one is heat or varicocele. So here if you see, varicocele is totally a different topic. So heat, normally testes, they stay away from the body. The testicular temperature is 2 degrees lesser than the body temperature. So always when the gap maintains, the production is normal. So whenever the heat in the testis goes up or temperature in the testis goes up, sperm production comes down. There is an equation which says that every single degree rise in temperature, testicular temperature, will suppress sperm production by 17 to 20%. So now normally if a person is continuously sitting for hours together, there is a lot of heat which is generated because there is no air circulation. Second, if you are using a laptop without any proper insulation, again this heat directly is transmitted, and people working in hot environments, they have this effect on the testis. And even varicocele, on people wearing tight undergarment, tight jeans, they will have high testicular temperature which affects their sperm production. And other factor which is commonly seen in males, 30% of the males will have varicocele problem. Varicocele means abnormal blood vessels in the testis. So because of this abnormal blood circulation, heat increases. This heat again, it can cause low sperm count, oligospermia. Okay viewers, now regarding individual causative factors, I will try to make videos. Please keep watching, subscribe to our channel, and if you want any other video, specific video, we'll try to make a video on particular topic. Please write in comment section. Keep watching. Thanks for seeing this video. Goodbye viewers.